All right, future nurses, are you ready? Today, we are diving deep into the world of Mark Klimek to conquer that NCLEX.
Absolutely.
We're taking your study guides, that Blue Book MarkK1.pdf and the Mark Klimek's lecture notes.pdf, and we're going to help you ace this thing.
Yeah, we're going way beyond just memorizing facts here.
Right.
This is about building a rock-solid foundation so you can walk into that exam confident and ready for anything.
Love it.
And then crush it in your nursing career.
Yeah. So let's start with the basics.
Yeah.
Foundational nursing concepts. They might seem simple.
Right.
But trust me,
Yeah.
the NCLEX can throw some curveballs your way.
They can.
So, nutrition.
Yeah, nutrition.
Klimek really dives into the nitty-gritty, and there's some things in there that I think could definitely trip you up.
Yeah, he highlights things that you might overlook. Like, we all know carbohydrates are a primary source of energy.
Right.
But proteins, they're crucial for a ton of different things in the body.
Yeah, it's like having a car versus actually being able to drive it. Like, you need the fuel, sure, but there's so many other components that keep that thing running.
It's all connected, and those vitamins and minerals, they're like the unsung heroes, right?
Oh, yeah.
They might not give you energy directly,
Right.
but they are essential for all those reactions happening behind the scenes.
Okay, so we've got the fuel. Now let's talk about the language of healthcare, because Klimek throws a ton of medical abbreviations at us.
Oh, yeah, and you know, the NCLEX loves those abbreviations.
Oh, they do.
But what's so cool is how he uses them as a jumping off point to really get into the meat of these conditions.
I like that.
Like, take BPH, for example.
Okay.
Benign prostatic hyperplasia, super common, especially as men get older, and it can cause a whole bunch of problems in the urinary department.
Like what? Paint me a picture here.
Okay, so imagine your prostate is enlarged.
Okay.
It's pressing on the urethra.
Okay.
What's that going to do?
Make it harder to pee.
Exactly. You got to increase frequency, decreased force of the stream.
Oh, wow.
Hesitancy, that's the medical term for, like, trouble starting. Okay, and then even waking up in the night to go, that's nocturia.
So how do they even diagnose that?
Well, a digital rectal exam is the gold standard.
Oh.
Not the most fun procedure, but it is quick and effective.
Right.
Gives the doctor a clear picture of what's going on.
Makes sense. And then once they get that diagnosis, what's the treatment plan look like?
So it can vary,
Okay.
but often it involves medications and sometimes even a procedure called a transurethral resection of the prostate.
Okay.
That's where they go in through the urethra and actually remove some of that excess prostate tissue.
Oh, wow. That sounds intense.
It can be.
Are there any dietary recommendations that go along with that?
Actually, yeah, Klimek talks about this thing called an acid ash diet.
What?
Acid ash diet.
I know, right?
So before you start picturing like a plate full of lemons and vinegar,
Yeah.
it's not what you think.
Okay, so what is it?
So it's basically choosing foods that decrease the pH of your urine,
Okay.
make it more acidic, might seem counterintuitive,
It does.
but it can actually help with those BPH symptoms.
Interesting.
So think cheese, eggs, meat, fish, cranberries, even,
Really?
yeah.
Things you might not typically associate with like a healthy diet.
Right, exactly. So it's not always about cutting back on certain things. It's about what's appropriate for the specific condition.
That's so interesting. It's all about the why behind the what.
Exactly. And that's what I love about Klimek. He gives you the tools to really think critically about patient care,
I like that.
which is what you need for the NCLEX and for being a good nurse.
Absolutely.
Yeah.
Okay. So let's say someone's had that TRP procedure. What happens after?
Okay.
What's the recovery like?
Well, one of the most important things is preventing clots and making sure that urine can drain properly.
Right.
And that's where CBI comes in, continuous bladder irrigation.
Okay.
Basically, we're talking about continuously flushing the bladder with a sterile solution, usually normal saline.
To keep everything flowing.
Exactly, precisely.
Okay.
And here's a little NCLEX tip from Klimek. You want to make sure that solution is running at a rate that keeps the urine clear and free of clots.
Okay, so what happens if there is blood? What do you do?
Oh, that's when your nursing instincts come in.
Okay.
If you see blood increasing, the first thing you do is you gently pull on that catheter to apply pressure on the prostate using the Foley balloon.
Okay, so direct pressure to control that bleeding.
Exactly.
Okay.
Now, if there are clots in the tubing,
Okay,
you're going to increase the flow rate of that CBI.
gotcha.
Try to flush those clots out.
So it's all about restoring that nice, clear urine flow.
Exactly.
This is fascinating stuff.
Yeah, it is.
So we talked about when things go wrong, but what about just getting back to normal life?
Yeah.
what can patients expect after a therapy?
Well, one thing Klimek really emphasizes is those perineal exercises.
Okay.
Kegel exercises.
Oh, right, of course.
Yeah,
To strengthen those muscles.
exactly. Regain that bladder control.
Because dribbling can be a concern after surgery, right?
It can be, yeah, usually temporary, but definitely something to be aware of.
Okay, so we've covered nutrition, BPH, TRP, CBI, perineal exercises. We are really getting into the urology groove here.
We are, and believe it or not, we're just scratching the surface of what Klimek covers.
It's amazing how much goes into these procedures.
Yeah.
You know? It really makes you appreciate the level of detail that nurses have to be on top of.
It really does. And speaking of essential nursing knowledge,
Yeah.
Klimek doesn't stop at BPH. He throws a whole bunch of other conditions our way.
Oh, I bet. Like what?
Well, he talks about the importance of being able to recognize and respond to transfusion reactions.
Yeah, that's right, because you have to
Yeah.
be able to spot those red flags really quickly.
Exactly. And he really emphasizes the different types of reactions you might see,
Okay.
like hemolytic, febrile, allergic,
Okay.
each with their own set of symptoms.
So let's say you're monitoring a patient during a transfusion.
Yeah.
What's going to make you hit the panic button? What are you looking for?
Okay, so picture this. Your patient starts shivering, they've got a pounding headache, and their blood pressure just tanked.
Yeah.
That could be a hemolytic reaction,
Oh, wow.
which is serious business.
Confusion during a transfusion. That's scary.
It's not something you'd expect, but Klimek really drives that point home.
Wow.
And then there are the allergic reactions with hives and wheezing and itching, even
That's wild.
joint pain.
So it seems like if anything seems even remotely off during a transfusion, you stop it, start running the saline, and call the doctor.
You got it. Early intervention is key.
Okay.
Now, switching gears a bit, Klimek also talks about something that tends to trip students up, telling the difference between angina and an MI, a heart attack.
Oh, yeah. Those always get me. They seem so similar on the surface.
Right. So Klimek emphasizes looking at how the patient responds to nitro and rest.
Okay.
If the pain goes away, it's more likely to be angina.
Okay.
But if that pain sticks around even after nitro and rest, that's a red flag that it could be a heart attack.
So it's all about that response to treatment.
Mhm.
Are there any other little pearls of wisdom that Klimek throws out there that we should keep in mind for the NCLEX?
Oh, tons. He's got a knack for it. But one that comes to mind is about angina.
Okay.
He says you can give up to 3 nitro tabs 5 minutes apart before calling the doctor.
3 tabs, 5 minutes, call the doctor.
Got it. There you go. Easy to remember.
It's like a little mantra for managing angina.
Exactly. He also covers those more, I guess you could say, nuanced aspects of care, like how to manage increased intraocular pressure, which can lead to glaucoma.
Glaucoma, that's the one that can cause blindness, right?
That's the one in Klimek. He really stresses that pain, restlessness, and a rapid pulse, those are your key signs that something's up.
Wow, so it's all about connecting those dots
Absolutely.
between symptoms and complications.
He wants you to think like a nurse,
Yeah,
not just regurgitate facts.
I like it.
Now, remember those catheters we were talking about earlier?
Of course, how could I forget?
Well, Klimek's a big proponent of proper catheter care,
Makes sense.
especially when it comes to UTIs.
Yeah, that's a huge concern, especially with those indwelling catheters.
For sure, and he really stresses maintaining a closed drainage system.
Okay.
You want to avoid disconnecting that tubing unless you absolutely have to.
To minimize that risk of infection.
Exactly. And here's a direct quote.
Okay.
He says, "Is it okay to routinely irrigate indwelling catheters? No.
No.
No. Unless there's a specific order from the doctor, you don't do it.
Interesting.
No unnecessary flushing.
Got it. What about cleaning the catheter itself? What's the best way to do that?
Soap and water, that's your go-to.
Easy peasy.
And make sure you secure that catheter properly."
Right. Don't want it going anywhere? It shouldn't.
Exactly. For female clients, that usually means securing it to the upper thigh.
Okay, now I want to go back to those UTIs for a sec.
Sure.
What are some of those telltale signs that you want to watch out for as a nurse?
So cloudy urine, foul-smelling urine, hematuria, those should all send you running for a urine dipstick.
And if that dipstick confirms a UTI, you're informing the doctor right away, right?
Absolutely. Early treatment is key.
Got it. Okay, so we've talked about UTIs. Now let's talk about a condition that requires a whole different approach to diet celiac disease.
Ah, yes. Celiac disease, no gluten allowed.
Right. Seems like everyone is gluten-free these days.
I know, right? But for people with celiac, it's not a choice.
Exactly.
This is serious stuff.
Yeah.
Even tiny amounts of gluten can wreak havoc on their small intestine.
So what does Klimek say about managing it?
He goes into great detail about the importance of sticking to a strict gluten-free diet.
Okay.
He gives a really clear breakdown of which grains are okay and which ones are absolutely off limits.
Okay, like what?
So rice and corn are usually safe bets,
Okay.
but wheat, barley, and rye, those are a big no-no.
It's like you're navigating a minefield of food.
It really is, and it's not always obvious, you know?
Right.
Gluten can hide in sauces and dressings, even some medications.
It's everywhere.
You really have to read those labels carefully.
So we've got to keep our eyes peeled for gluten.
Yes.
And speaking of keeping our eyes peeled, what about strokes? Klimek talks about those too, right?
He does. Those are high-stakes situations.
For sure. Time is of the essence.
Absolutely. And he emphasizes how important it is to recognize the symptoms quickly.
Okay.
He reminds us that often a change in LOC, level of consciousness, that's the first sign.
So if someone's suddenly confused or disoriented?
Could be a major red flag.
Wow.
Now, he also tackles a common misconception
Okay.
that men are more prone to strokes.
Oh, interesting.
It's true that men have a higher risk when they're younger, but women actually catch up and surpass men as they get older.
Well, the tables turn.
They do.
I know
And
that.
then you've got those risk factors like taking oral contraceptives, obesity, smoking, and atrial fibrillation.
So many factors to consider.
It's all about awareness and early intervention.
Okay, so let's say the worst happens and someone is having a stroke. What are some of those immediate things that nurses need to do?
Klimek really emphasizes absolute bed rest, fluid restriction, and frequent repositioning
Okay, frequent repositioning, how often are we talking?
every 2 hours.
Okay.
And he's very specific about patients with right-sided paralysis, those with right hemiplegia.
Okay.
They should not be on their paralyzed side for more than 20 minutes at a time.
20 minutes, that's so specific.
It is, but it's all about preventing skin breakdown and promoting good circulation.
Makes sense.
Sometimes you got to think outside the box.
I'm learning so much. This is great.
Klimek really goes above and beyond.
He does. It's impressive.
Now, I know we've covered a lot, but we can't forget about the mental game of nursing.
Right. Because the NCLEX isn't just about medical knowledge. It's about critical thinking, prioritization, keeping your cool under pressure.
Yeah.
It really does feel like nurses need nerves of steel. We've talked about so many intense situations today.
You're telling me you need those sharp clinical skills for sure, but also that ability to stay calm and think clearly under pressure, especially when you factor in the psychological side of patient care.
Absolutely. And that's where I think Klimek's insights into psychiatric nursing are so valuable.
Oh, for sure.
Because it's one thing to understand like a physical condition,
Right.
but navigating the human mind, that adds a whole other layer of complexity.
It really does. And he starts with a really important distinction that a lot of people get tripped up on, that difference between psychotic and non-psychotic behavior.
Okay, walk me through it. What are we looking at here?
Okay, so let's say you have a patient who's feeling super anxious, really overwhelmed, someone who's non-psychotic. They still have insight.
Okay.
They know they're struggling.
Right.
They can connect those feelings to what's happening around them.
They haven't lost touch with reality.
Exactly. Now someone experiencing psychosis, they've lost that connection.
Oh, wow.
Their thoughts and perceptions are distorted.
Okay.
They might have hallucinations,
Okay.
like seeing or hearing things that aren't really there.
Right.
Or delusions. Those are those fixed false beliefs.
Okay, see, I always struggled with hallucinations versus delusions. What's a good way to keep those straight?
Klimek uses a really good analogy. He says, think of a hallucination as like a sensory experience without an actual source.
Okay.
Like your senses are playing tricks on you, so it's not that they're making it up.
Right.
It's that their brain is misinterpreting the information.
Okay.
A delusion, on the other hand, is that fixed false belief, no matter what you say, no matter what evidence you provide.
It's like unshakable.
Exactly.
Wow. Okay, so how do you even approach a patient who's having a delusion or a hallucination?
Oh, that's the million-dollar question.
It seems so sensitive, you know?
It is, and you want to acknowledge their experience without feeding into it.
Right.
It's a fine line you have to walk.
So like if they say they see unicorns in the hallway, you're not going to be like, oh yeah, me too.
Exactly.
Okay.
You might say something like, I understand that you're seeing something, but I don't see it.
Right, so you validate how they're feeling, but not necessarily what they're seeing.
Exactly, and redirecting them to something grounded in reality can really help.
Like what kind of stuff?
Simple tasks like folding some laundry, having a conversation about something neutral.
It's amazing how much those little things can mean to someone who's in that headspace.
It really is.
Now, Klimek also gets into some pretty, I don't know, like heavy stuff, suicide, abuse, Those have got to be tough for nurses to deal with, too.
They are, and he really drives home the point that you have to be assessing for suicide risk in any patient who expresses those feelings of hopelessness, of just wanting to die, and not just once. You got to be vigilant throughout their entire care.
So you're watching for those changes, those little comments they might make.
Exactly, exactly. And remembering those key risk factors, statistically speaking, men are more at risk than women.
Right.
Relationship status matters too. Those who are separated or divorced, they're at higher risk than married folks.
Wow, so it's like you're almost creating this mental checklist of things to be aware of. So let's say a patient does express those thoughts. What happens next? What do you do?
You got to have a plan. And Klimek, he outlines those crucial suicide precautions,
Okay.
removing anything they could use to harm themselves.
Right.
One-to-one observation, notifying the physician immediately.
So it's all about acting quickly and creating that safe environment.
Exactly.
Okay, let's shift gears to another tough one. Abuse.
Yeah.
I imagine that's really hard for a lot of nurses to deal with.
It is, and Klimek really hones in on the insidious nature of manipulation.
Right.
It's something that abusers use a lot.
Because it's so subtle, isn't it?
Exactly. It's about influencing someone to do something they wouldn't normally do, often by preying on their vulnerabilities, and he gives a really good example.
Okay.
A mother who pressures her adult son to buy her alcohol even though he knows it's wrong.
It can happen in any family, in any relationship, really.
It can, and it highlights that it's not always just about the victim.
Right.
It's about the enabler, too.
It's so complex.
It really is. And Klimek, he really encourages nurses to approach these situations with compassion,
Of course.
but also that focus on setting boundaries and promoting healthy coping mechanisms.
For everybody involved.
Yes, exactly.
Okay, so we've talked about those more serious topics, but I also love that Klimek gives you these practical tips for dealing with, everyday nursing challenges.
Absolutely. Delegation, prioritization, therapeutic communication, he's got you covered. And he makes it fun.
Fun. We're talking about nursing textbooks here.
I know, but trust me, even those select all that apply questions on the NCLEX.
Oh, don't even get me started on those. Those are the worst.
I know, but he has a really good tip for those. He says, treat each option as a true or false question.
Oh, that's smart.
Right. So instead of trying to pick all the right answers at once, you're like, is this true? Is this false?
That breaks it down so much easier.
Exactly.
Okay, what about those questions where we have to prioritize patient care?
Oh, the prioritization questions.
Those are like a whole other beast.
I know, and this is where Klimek really shines. He talks about finding that modifying phrase.
The modifying phrase, what's that?
Okay, so it's a part of the question that tells you what's most important. So let's say the question says, which patient should the nurse see first?
Okay.
The modifying phrase might be, who is experiencing shortness of breath?
Okay, so you're not just looking at their diagnosis.
You go right to the most urgent need.
That's so helpful.
Right, he's got a whole system for it.
This is pure gold.
Here.
Now, before I forget, we have to talk about lab values because there are so many to remember.
Don't worry, Klimek's got your back. He breaks it down with an easy system.
Okay, hit me.
The ABCD scheme.
ABCD.
Yeah.
That seems almost too easy. Is it really that simple?
It is. A, everything's normal. You're good to go.
Okay.
B, it's a little off, but you just need to monitor, keep an eye on it.
Okay.
C, it's critical. You need to take action.
Uh-oh.
And D, that's the call the doctor stat level.
Okay, so it's like a triage system for your lab value.
Okay. Exactly.
Like, I love it.
And he gives you specific examples for each level so you know what to do.
Like what? Give me an example.
Okay, so let's say you got a patient with a potassium level over 6.
Okay.
That's a D. That is a call the doctor stat situation. You want to hold any potassium supplements, check their EKG, get that calcium gluconate ready just in case, and of course call the doctor right away.
Hold the potassium, check the EKG, get the calcium gluconate ready, and call the doctor.
You got it.
See, this is why I love Klimek. He takes all this information and he makes it make sense.
Right. It's clear, it's concise, it's memorable.
Okay, before we wrap up this deep dive, is there like one final pearl of wisdom that we can take with us into the NCLEX trenches?
Don't underestimate the power of an educated guess.
An educated guess. I thought there was no guessing on the NCLEX.
Okay, knowing your stuff is essential,
Right.
but there are going to be those questions where you just aren't 100% sure.
Oh, I know it.
Instead of panicking or just randomly picking something, Klimek says use what you do know to eliminate the answers that are definitely wrong, and then make your best guess from what's left.
So it's about being strategic.
Exactly. And he even gives some tips for different topics. Like if you're stuck on a psych question, he says, establish a trust relationship or explore your own feelings.
Those always seem to be good options.
Right. So even if you're not sure about the specifics, you can fall back on those core principles of therapeutic communication.
It's like a safety net.
Exactly. And for those nutrition questions, if all else fails, baked chicken is usually a winner.
Go chicken. Got it. I'm feeling so much more prepared to tackle this exam now.
That's what I like to hear. Remember, knowledge is power, and with Climec on your team, you've got this.
I love it. Well, this deep dive has been incredible. We've covered so much ground, from the foundations of nursing to those NCLEX strategies that you absolutely need to know.
It's been fun.
A huge thank you to you, our resident Climec expert.
Thank you for having me.
And to all of our listeners, thanks for joining us on another deep dive into the world of nursing. Remember, you are all smart, capable, and you are going to rock that NCLEX. Until next time, keep on learning, and we'll catch you later.